What if it were gone in an instant? Everything. Everything you've worked for, everything you've created and built, everything you've invested. Your family, your wealth, your plans for the future, your dreams and memories. And worse, what if you never saw it coming? You've worked hard to build a business, generate wealth for you, your family, your employees, and shareholders. Don't lose it all because you ignore the number one cause of death. Around the world, the chance of you having a major heart attack or stroke is nearly 75%, and half will die from it, without a single symptom or warning sign. How could this happen? Over the next few minutes, you'll learn the 4 major failures of the current medical system. The 4 life-threatening failures result in a waste of your hard-earned money, a loss of your valuable essential time, potentially the wrong diagnosis, and the incorrect medical treatment, which can lead to a risk of unnecessary medications, procedures, or worse, your death. Today's medical system is outdated, resulting in millions of unnecessary medical procedures and avoidable deaths. We truly believe most doctors have a caring heart and generally want the best for their patients. Until recently, the tools for providing the next generation of cardiac care, resulting in the right diagnosis 100% of the time, had not been fully developed. Sadly, most care providers are still unknowingly providing care for their patients the old way. Not only that, our current medical system costs too much, takes too long, is too complex, yet still produces inefficient, life-saving results. I've seen the current system fail too many times, and today, I'm speaking up. Cardiologists are not talking about arterial plaque enough. Arterial plaque is the only true indicator of your risk of heart attack or stroke. So let's talk about it.
I'm Dr. John Osborne. I'm a Harvard-trained cardiologist with nearly 3 decades in preventative cardiology and the chief medical officer behind Clear Cardio. Not only do I have a medical degree, but I'm also a scientist with a PhD in cardiovascular physiology. Like you, I've also worked hard to build a career, and I have people who depend upon me. My life's work has been to eliminate death from heart disease, and no one should die from an easily identified and treatable disease. So what are the problems with the current medical system? Today, we will dive into the big 4 that directly impact you, the tens of thousands of dollars you spend on medical expenses needlessly, the hundreds of hours you waste traveling back and forth in and out of doctors' offices and hospitals, and the stress and anxiety of waiting to know what's wrong with you, the mental anguish and emotional turmoil you experience as you navigate the quest of finding the right answers to your health, the potential for undergoing unnecessary invasive procedures or being given medications you don't need, all because of misdiagnoses. Current diagnostic procedures result in more than 25% false positive and false negative results. You have worked hard your entire life to build wealth. You don't spend it on things that are completely useless. Do you know how much plaque is in your arteries? I'll bet the answer is no. Why? Because none of the expensive diagnostic strategies generally used today identify and quantify the true cause of heart disease, which is arterial plaque. Think about it. Heart catheterizations, the current diagnostic strategy for heart disease, can cost upwards of $30,000, including a, quote, gold standard, end quote, heart catheterization. This invasive procedure involves threading a catheter through your blood vessels to your heart. While it can reveal blockages, it doesn't provide a comprehensive view of plaque buildup in your arterial walls. Stress tests and EKGs, these tests monitor how your heart performs under stress, but can miss significant plaque accumulation that hasn't yet narrowed your arteries enough to cause symptoms or abnormal results. Echocardiograms and nuclear stress tests, these imaging techniques can show you how well your heart is pumping and if there are areas with reduced blood flow. However, they still don't locate and measure the amount of plaque in your arteries. The shocking truth is that traditional diagnostic methods only detect heart disease once it has progressed to a dangerous stage. By then, the plaque has already narrowed your arteries significantly, putting you at a high risk of a heart attack or stroke. Imagine this scenario. You've invested a ton of money into a comprehensive health checkup and your tests come back normal. You leave the clinic feeling relieved, thinking you're in the clear. But unbeknownst to you, the plaque is growing undetected within your arterial walls. This undetected plaque is a ticking time bomb. Why does this happen? Because the traditional approach to heart disease diagnosis is fundamentally flawed. It focuses on detecting blockages rather than the underlying cause, plaque buildup. This leaves you with a false sense of security, believing your heart healthy when you're actually at significant risk. Next, so you've spent the money. Now, how precious is your time? What's time worth to you? Is your time precious? Does the time lost at the office matter to you? How about time spent with your family and friends? Or the time you planned to travel and explore new and exotic places? You've worked so hard to live the good life, haven't you? In today's healthcare landscape, the misdiagnosis of life-threatening conditions leaves many individuals left in the dark about their heart health until it's too late. By the time a person is referred to a cardiologist, precious years may have passed, allowing the plaque to grow around your arteries undetected. But it doesn't stop there. Once you've seen a cardiologist, the typical timeline from the initial visit to a final treatment plan can span weeks or even months. That's assuming the patient was prescribed the accurate treatment plan in the first place. This is a systemic flaw that doesn't just squander your money, it squanders something even more valuable, your time and your peace of mind. Consider the journey. You spend weeks waiting for a referral to see a cardiologist, only to have a brief consultation that may lead to more tests. Each diagnostic test, from stress tests to echocardiograms, requires scheduling, preparation, and follow-up, often resulting in additional delays. Even after undergoing a battery of tests, you still do not get a clear answer. Traditional methods focus on detecting symptoms or blockages, not on the plaque that's building up within your arterial walls. If further procedures are needed, you're faced with more waiting, more appointments, and more uncertainty. In the end, you're still only treated for the immediate symptoms and not addressing the root cause of the disease. This process not only prolongs your anxiety, but also increases the risk of plaque buildup progressing without adequate intervention. The system is reactive, not proactive. It addresses symptoms after they appear rather than preventing them in the first place. Moving on to problem number 3. So you've spent the money, you've invested the time, so what do you get? You likely underwent an EKG, a stress test, and an echocardiogram. If any of these tests hinted at issues, you might have been subjected to a nuclear stress test and even an invasive heart catheterization. And yet, with all of these procedures, the critical question remains unanswered. How much arterial plaque do you actually have? None of these traditional tests can quantify the plaque lurking in your arteries, leaving you in the dark about the true severity of your condition. You might be left thinking you're fine, despite the danger silently growing undetected within your arteries. Without knowing your exact plaque burden, you and your doctor lack the crucial information necessary to assess your real risk of a heart attack or stroke. This oversight not only undermines your sense of security, but also hinders effective preventative care. So you've spent the money, you've invested the time, and yet you still don't have the real answers you need. Beyond the financial and physical tolls, there's a profound emotional burden that patients endure. Navigating the medical system in search of definitive answers about your health can be a mentally exhausting and distressing journey. Imagine the mental anguish of being shuffled between specialists, each visit bringing more questions than answers. The constant worry about your symptoms and the fear of an imminent heart attack or stroke can be overwhelming. Many patients feel like they're on a never-ending treadmill of tests and consultations, but still without clarity. Consider the emotional roller coaster. Feeling unheard. You express your concerns and symptoms, but instead of feeling understood, you encounter a barrage of tests that seem to lead nowhere. Each test might come back normal or inconclusive, leaving you feeling unheard and frustrated. Confusion and anxiety. The complexity of the healthcare system can be bewildering. Different doctors might offer conflicting opinions, and the medical jargon can be confusing. You're left trying to piece together a coherent picture of your health, all the while grappling with fear and uncertainty. Fear of the unknown. Every day, the fear lingers in the back of your mind. What if today is the day you have a heart attack? You've seen friends, family, and colleagues succumb to sudden heart issues, and you wonder if you will be next. The worry about family history. If heart disease runs in your family, this worry is magnified. You live with the constant anxiety that your genetic predisposition might catch up with you, despite your best efforts to stay healthy. The new way. Imagine a paradigm shift where the diagnosis and treatment of heart disease are no longer reactive, but proactive, precise, and empowering. Forget the outdated methods that only catch problems after they become severe. The new approach leverages state-of-the-art technology to provide a comprehensive and clear view of your arterial health. High-resolution, three-dimensional cardiac CT angiography combined with advanced AI imaging analysis now allows us to detect and quantify plaque down to the finest detail, something that was unimaginable just a few years ago. Unlike the invasive procedures of the past, this new method is non-invasive, quick, and incredibly effective. In just a matter of minutes, we can produce a detailed three-dimensional image of your coronary arteries, pinpointing the exact amount and location of plaque buildup. Plaque starts in the wall of the blood vessels and grows outward, maintaining a normal blood flow channel until it can no longer expand. Once this limit is reached, it begins to restrict the vessel. Traditional tests only identify problems when the narrowing is severe, typically at 70% or greater. By then, the plaque has been growing undetected for years, posing a major hidden threat to your life. With this advanced technology, you don't have to wait for symptoms or abnormal stress tests to take action. Symptoms like chest pain or breathlessness or even abnormal results on a stress test or EKG indicate a problem when it's often too late. Our approach catches the danger early before it can cause irreversible damage or sudden cardiac events. This revolutionary method isn't just about finding problems, it's about preventing them. It's about giving you the knowledge and tools to protect your heart proactively and effectively. At Clear Cardio, we are at the forefront of this technological revolution, transforming how heart disease is detected and treated. Our mission is to provide you with the most accurate, comprehensive, and compassionate care possible. We utilize the latest advancements in cardiac CT angiography and AI imaging to deliver a detailed, precise assessment of your heart health. Our technology allows us to measure the total plaque volume in your arteries, giving you a complete and accurate picture of the disease. At Clear Cardio, our number one priority is you, the patient. We understand the stress and anxiety that come with not knowing the true state of your health. That's why we are committed to providing personalized, compassionate care that addresses your specific needs and concerns. So now it's time for me to call you out. If you've ever had a procedure for a heart condition, you should be reaching out to us. Recovering from heart surgery or a recent cardiovascular procedure is a significant milestone, one that comes with its own set of challenges and uncertainties. You might be feeling a sense of relief now that the procedure is behind you, but also a heightened concern about your future heart health and what steps to take next. Your journey to full recovery doesn't end in the operating room, it's only the beginning. If you're experiencing any of the following symptoms or conditions, it's crucial that you contact our team without delay. Your life is a priority, and taking steps to protect it must not be postponed.
At Clear Cardio, we provide a revolutionary comprehensive heart health service that transforms the cardiovascular care and the way it's managed. We combine advanced technology with unparalleled personal care to ensure you receive the best possible support throughout your entire journey to heart health. At Clear Cardio, we take care of every detail. From the moment you contact us, we'll handle all aspects of your heart health journey. You won't have to worry about scheduling appointments, managing paperwork, or dealing with insurance complexities. We'll handle it all for you, so you can focus on what matters most, your health and peace of mind. We believe in a patient-centered approach that goes beyond diagnosis and treatment. Our team is dedicated to educating you about your heart health and guiding you every step of the way. You'll have access to the best cardiovascular specialists in the United States. Our elite team of doctors is renowned for their expertise and commitment to excellence, ensuring you receive world-class care and the latest in heart disease management. We provide tailored wellness plans that include dietary advice, exercise recommendations, and lifestyle adjustments to help you maintain a healthy heart. We also have top wellness experts to monitor your health for the entire year who will support you, guide you, and hold you accountable to maintaining your health protocols. At Clear Cardio, we're more than just a healthcare provider. We're your partner in heart health. We're committed to providing you with the support and guidance you need to lead a healthy, fulfilling life. We understand the fear and uncertainty that comes with your heart health issues. Our compassionate team is here to provide you not only with medical experience and expertise, but also emotional support, ensuring you feel cared for and understood throughout your journey. Your heart can't wait. Don't risk it when you can have the certainty and peace of mind that comes with Clear Cardio's comprehensive care. Using the link below, schedule a call now with one of our Clear Cardio concierge representatives for your cardiac health assessment. We'll take care of your heart, and you take care of planning for your future.